Monday Health Minutes, sponsored by Valley Health.
You know, when you go to the doctor, you're looking for better overall health, physical and mental. I'm Melanie Schaefer. This is Valley Health Minutes, and today we're talking with Dr. Kellee Boster about integrated primary care. What exactly is that, and what are the benefits? Tell me about IPC. What exactly is it?
Sure. So IPC is integrated primary care, and this is a model of care that combines multiple service lines together. So in this case, medical and behavioral health, mental health needs together at one point in time, in one space, one location, so that it can really enact change for a patient in that moment, the same day as a medical care appointment.
Sounds like it can be a time saver and trying to get everybody on the same page, the same team. So real big benefits for the patient.
Oh, major benefits. It helps with travel time and going to multiple different appointments at different locations, and extra co-pays for different appointments. So many different benefits related to that. And also it's important to note that we have behavioral health consultants that are involved in IPC, and so including myself and several others on the team, we are all trained clinicians and therapists in health service psychology, and we are embedded in primary care. So we are right there, and we can provide same-day access at certain Valley Health locations, not all of them.
So talk to me about what conditions can help and have this kind of therapy and this kind of treatment approach.
Sure, a multitude of problems can be addressed in IPC. You know, oftentimes a patient presents into primary care with physical ailments that are adversely affected by stress, and then conversely might have mental health concerns that worsen the ability to engage in self-care or to care for medical conditions. And so having said that, we try to address the gamut. And so a lot of behavioral medicine concerns are targeted issues that you might expect to see with one of us that we can help you with. A lot of things that people ordinarily don't even know, couldn't imagine a behavioral health provider might help them with. So for example, chronic medical conditions such as diabetes, hypertension, COPD, irritable bowel syndrome, migraines, also insomnia, sleep problems. We do a lot of work with weight management, smoking cessation. So you kind of get the idea.
Yeah.
We can do a lot of things. And then of course we address behavioral health concerns, common behavioral health concerns like depression, anxiety, bipolar disorder, post-traumatic stress, grief, addiction, substance misuse.
So walk me through it from the patient perspective. How does this look if I'm a patient? Am I asking for this kind of service? Would your provider say this might be a benefit to you to kind of get everybody on the same team and do integrated primary care?
Both and. So it can go either way. Yeah. So you can go to a medical appointment, and I should also say it's not just with a primary care provider. It's in any of our medical service lines. They can get you connected with integrated primary care, our consultants. So that can be OBGYN, dentistry, optometry, but any of our medical service lines. So having said that, at an appointment, you could specifically request, hey, can I get a referral to schedule an appointment, or do you have somebody here at that location that can see me right away? And we can go meet with you that same day, even without having to schedule an appointment if you're at one of those locations. Or maybe if your medical provider gets the sense that this might be something that you could benefit from, even if it's just for one visit, they might mention it to you and see if you're interested, and then get you connected.
There's evidence behind this type of treatment that it can be really effective for patients.
Yeah, so our behavioral health consultants use evidence-based interventions, so different components of cognitive behavioral therapy or dialectical behavior therapy, depending on the patient's needs. We customize it to tailor what they need, and so there's a lot of scientific support in using these types of interventions.
All right, it's really interesting. How can people learn more about this?
Sure, a variety of different ways. Call your local Valley Health office and see if behavioral health is offered there, and integrated primary care specifically. And if not, then somebody can help navigate that and get you directed to one of our locations that does offer it. Next time you're at a medical appointment with a Valley Health provider, you can ask about getting connected that day or getting a referral. You can go to www.valleyhealth.org. So lots of different options.
Lots of different options to learn again about integrated primary care. Dr. Boster, thank you so much. Thanks for being here for Valley Health Minutes. We'll see you next Monday.